by Joy Smith, our Communicable Disease Director here in Mecklenburg County. And so I think we'll start with COVID-19 and then we'll transition to impacts from there and look forward to any questions folks may have thereafter. The big update on COVID today, as many folks probably saw last week, our community did return back to the medium CDC community level, which indicates market improvements in our COVID-19 rates, both our case rates, hospitalizations, as well as I'm ask folks to just keep yourselves on mute if you're not speaking. But marked a decline in all of our key indicators. Our hospitalizations are declining, case rates are declining. We have seen very significant improvements in our wastewater surveillance. And so we've seen declines at all of our sites, some of them returning back to viral levels that we have not seen since earlier part of this year in the springtime. So very encouraged about what's happening with the current sort of circulation of COVID-19 in the community, and those improvements are welcomed. Next, I want to give an update on COVID boosters. I think as many people probably saw the news last week, the FDA and the CDC both cleared and recommended the updated bivalent COVID-19 boosters. Those are available. They will be available this week in our community. And so we did receive a shipment of those at the health department today and expect to be available to residents as early as tomorrow in the community here, as well as through a number of our community partners. Those booster doses are recommended for anyone who has received the primary series of COVID-19 booster vaccines, regardless of your prior booster status. There are some conditions, for example, if you've had a booster or additional dose in the last 2 months, it is recommended that you wait until you get to the 2-month mark. There's also some recommendations for individuals who've had a recent COVID infection, also to wait some period of time until before they come in and get that booster dose. And so we do ask patients to obviously consult with their primary care doctor or give us a call if they have questions about whether or not you're eligible or not, because I know it can get a little confusing with all of the sort of conditions and differing guidance for individuals. But certainly the high level is that everyone should get a new booster. Everyone is eligible to receive it if you're over the age of 12 specifically. So this is not approved for people under the age of 12. And so those individuals, we ask that they go ahead and seek out a booster. We do know that they will be shipped, both the Pfizer and Moderna products will be shipped in waves. The health department was a part of the first wave. We are working with our partners at StarMed to also provide some additional vaccine to them this week so that they can go ahead and start administering booster doses. And then, of course, obviously we'll have some appointments available at the health department, but certainly encourage people to visit starmed.care. If they're looking for a booster dose quickly this week, they will be available as early as tomorrow. That's essentially the update on COVID. Happy to answer any questions when we get to the Q&A section. Now I'm going to pass it to Joy to talk a little bit about the epi and data of monkeypox here, mpox here in Mecklenburg County. And then we will, I'll come back and talk a little bit about the updated mpox vaccine eligibility, and then we'll take questions.
Good afternoon, everybody. Mecklenburg County is currently reporting 142 cases of mpox. The majority of those cases are male, 99%. We have 55% of the cases are within the 30 to 49 age range, and we continue to see a majority of the cases, 83%, in Black and African Americans. We're reporting 7 hospitalizations and still working to see. We can't directly attribute those to mpox, but we do know that that is that number, and no deaths related to mpox.
Great. Thanks, Joy. And as you all may have noticed, we did not report any additional cases over the weekend. And we are beginning to see a slowing in our case rate, which is certainly encouraging news for us. We are cautiously optimistic that this may be a good news or good sign for us as a community as we move forward with the current outbreak. We have in the last several weeks seen a decline in our weekly cases to the tune of roughly 36% since the peak, which was a few weeks ago. And so we're hopeful that our efforts on the ground to vaccinate, obviously educate, get folks tested and isolated are working. And so we continue to be encouraged by those trends and look forward to what happens over the next several weeks before we truly declare those as successful. The next update on Mpox that's really important is that beginning tomorrow, we will be expanding our eligibility for Mpox vaccines. And so we've had a set eligibility for the last several weeks. That eligibility is now going to be expanded. And so I'm going to just quickly review the criteria of who's eligible. And then again, we'll take any questions from there. So there are 4 groups of folks who are now eligible. The first one, of course, is our highest priority group, and that's anyone who has had a known close contact in the past 2 weeks with someone who has been diagnosed with Mpox. Or any individual who identifies as gay, bisexual, or other men who have sex with men, or transgender individuals who are sexually active, regardless of any other factor, as long as you report being sexually active, as well as people who've had sexual contact with gay, bisexual, or other men who have sex, men, or transgender individuals in the past 90 days. So that would include women, as well as any persons living with HIV, regardless of gender identity, or taking medication to prevent HIV, also known as PrEP, or who have been diagnosed with syphilis in the last 90, who've been diagnosed with syphilis in the last 90 days. So those are 4 new groups. Again, this is an effort by both the state and local health departments to be able to ensure that we are reaching those at greatest risk, and that making sure that we are doing everything possible to contain the spread of Mpox in our community. So with that, I'm happy to take any questions from you all for anything that we missed.
With our first question today is Hunter Sines, WSOC-TV.
Hey, Dr. Washington, thank you for your time. I know you said that you guys were part of the first wave. How many vaccines of this new booster did y'all get? And you said StarMed, is that the place people should primarily go as they have been doing through the pandemic?
Sure. Thanks, Hunter. So we received 1,100 doses in total. And as I mentioned, we're going to actually transfer a portion of those to our partners at StarMed to assist us with delivering more quickly in the community, as our clinics are a bit hectic right now with both Mpox back-to-school shots as well as COVID-19 boosters. And so I am encouraging folks to certainly reach out. I expect StarMed will have appointments again starting tomorrow. Not today, but not until tomorrow. But I would encourage people to reach out to starmed.care. And of course, we will have appointments here at the health department, but they will be, again, limited in availability this week due to all the activity that's happening in the clinics. But we will have appointments, and they will be available. But I'm encouraging folks to reach out to StarMed first, or their provider.
Next question is Chloe Leschner, WCNC.
Hi, Dr. Washington. Thanks for doing this. How urgently should people be going out to get these? I know there's the 2 months since, but people have obviously fallen out of the habit of, wanting to go get a vaccine so quickly. It's been a long time for people, though. So how quickly should we go out?
So certainly, we currently have fairly limited supply. As I mentioned, we only received 1,100 doses. And so I do think there's going to be probably a little bit more demand than we have supply available, at least here initially. And so of course, those who are at greatest risk, so those who are either immunocompromised or have not received any boosters at all, are those who I would say probably should go out more urgently than others. But certainly, it's available to anyone that's over the age of 12. If you've had a booster in the last couple of months, I would not encourage those folks to go immediately. I would wait at least until you get to the 2-month mark. And if you've had a recent COVID infection, like in the last 90 days, again, I also think that you have a little bit of protection offered from your natural immune response, specifically for the Omicron variant, because that is the one that's circulating. Those subvariants are the ones that are circulating predominantly right now in the community. But again, I know it's difficult to say all that in a short clip. And so I would just encourage folks, if you're over the age of 12 and you haven't gotten a booster, you certainly should come on in and get it.
Next question, Morgan Francis, Queen City News.
Hey, Dr. Washington, thanks for taking my question. the U.S. health authorities, it looks like they're going to recommend boosters once a year. Do you see this as something that's going to be pretty similar to the flu and that everyone's going to end up getting a shot once a year? And with what you said, anticipating more demand than supply, how are health agencies going to balance that out year to year?
Sure. I think it's the supply and demand issue is short term. I do know our federal partners are working to get as much vaccine out as quickly as possible. Of course, these are just approved last week. So pending approval and the recommendations from ACIP, certainly I know the manufacturers are going to work now to obviously produce as much as we probably need to meet demand. And so I think this will be a short-term challenge as it relates to supply and demand. I don't think it'll be like the early days of COVID vaccines where, we had, extended wait lists for long periods of time. But we're going to work to make vaccines available as quickly as possible in the community, which is, again, why we're partnering with StarMed and others to help us get vaccine out as quickly as possible.